Black women and birthing people are 12 times more likely to die or suffer a near miss. We have not just a maternal health crisis, but a reproductive health care crisis, where access to equitable, comprehensive care is being diminished, and we're seeing this through lack of access. We have hospitals that are closing at alarming rates. We have hospitals that are under-resourced in terms of their faculty that's there, right? So we have a shortage of nurses, we have a shortage of OBGYNs. We definitely have had an ongoing shortage of midwives, being able to provide comprehensive midwifery care. And that's just in the hospital-based settings. We have, residents who are overworked, who are oftentimes trying to do their best and really center a reproductive justice framework, but finding that, there are certain limitations to how they're even able to provide comprehensive reproductive health care. That on top of, we have a new administration, federal administration, that is attacking abortion care and access, federal funding, right? And federal funding affects the ways in which affects everything from Medicaid, and who is able to access healthcare services, as well as workforce, right? And so, a lot of healthcare jobs here in the state, and in New York City, as well, is funded by federal dollars, right? And those when those federal dollars are rescinded, then you find yourself with a workforce that you can no longer sustain. You find programs like HIV programs such as reproductive healthcare access, access to doula care, all of that is under threat. And so, where we were already living in a space where the conversation had just got to a precipice where we were even having a conversation around like Black maternal health. Now we are at a crux where, and things were starting to evolve, right? Trainings were starting to happen, and health equity and initiatives were, there was momentum around there. It was conversation. There is now, with the removal of DEI, with the removal of the possibility of removal of federal funding, we are bracing ourselves for seeing increase in maternal deaths, right? Not just for Black women and birthing people, but also um, Latinx individuals, for various different diverse populations of individuals who are just trying to thrive. You know what I mean? Like, not even survive, but they're trying to survive, but also we're in a crux of just trying to survive, right? So you're going to see an even greater burden within our healthcare infrastructure, especially within our ERs, right? So when people don't have access to healthcare, where do they go? They go to the ER, right? And so you see an influx of ER patients, you see misdiagnoses, you're going to see higher rates of probably near misses and things of that nature, because we may not, the infrastructure is now, it was already fractured, now it's just falling and crumbling underneath us. Community-based doula is, it's not, the term may sound new, but it's nothing new, right? And so, traditionally in all aspects of various different communities, there have always been, individuals, whether it was an aunt or a cousin or, the elder in the community or the midwife, there was someone who was gathering around someone who was pregnant, who was prepping that person for birth, right? Who was either helping folks to gather food or, gather the necessary resources, make a blanket, whatever the case may be, they were there. And so a community-based doula is doing all of those things, right? They're focused on the educational aspect, right? And so making sure that people are fully knowledgeable and prepared for what to expect in childbirth, are there to answer any kind of questions that may have that maybe they not necessarily have not gotten answered while they've been with their provider. We're there to help them to make an informed decision about that care. And so we're not telling people what to do, but we are, again, giving them the information to make the decision for themselves. We're concerned about their emotional well-being and their physical well-being, right? So offering comfort measures. We're doing home visits. We're also taking into consideration, again, the social aspects of things, right? So the social determinants of health. If someone is these social determinants play a key role again in how someone is or isn't able to show up. So we can say all day like, oh, there's access, but what does that really mean? Right. And so the community-based doula is going and doing the home visit. They are, seeing and connecting the dots. They're providing that continuity of care that may be missing when you go to see your physician, right? So like, when you go to your prenatal visits, in the very beginning, you're only seeing them once a month, and then when you get to your last trimester, then that's when you're going and you're having like visits like every week. But prior to that, what happens in between that time? When you have questions, when, if you go and your appointment is only 15 minutes and, you're trying to understand like, what does this heartburn mean? Or what does this back pain mean? Or is this symptom normal? Being able to have someone who you can rely on to go with you to your prenatal visits, who can answer those questions, is important, and that's what that community-based doula is doing. And again, you know, these are folks, the key word is community, which means that these are people who live and work in the same communities that the folks who are birthing with. So I can like walk down the street and see people who, I've helped their children to come into the world, right? And now their children are big and they're you know, teens or toddlers, and they're walking around and they're talking, and you're just like, wow, you know what I mean? And you're connected to that person because you were in one of those most intimate moments in their lives, right? But it's also about, um, in a place that, again, with a healthcare system that is fractured, that oftentimes is not listening to the voices of Black and brown people. It is knowing that you have that like mediator that's there, right? Just for you, right? We don't work for the hospitals. We work for the person who is, who is pregnant. We are, we're there to be the eyes and the ears, and to offer guidance and support. And again, and to help them to advocate for themselves and what that advocacy looks like for them. So it's not my ideal of what I think somebody should have, right? So I had home births for my children. Does that mean that everybody's supposed to have a home birth? No, but everybody should have the option to have a home birth if they want one, right? They should be able to have access to birthing centers if that's where they want to birth. They should be able to have access to go to a hospital if that's where they want to go, and to know that they can do that in a way that is safe, where they have the well-being of not just my child, but me, as an extension of my community, at heart. So, that's what the community-based doula essentially is. We have a coalition called Doulas for Democracy. It's a national program, but we have them in each state. And in New York State in particular, it's an opportunity for folks who, you don't have to be a doula. You could be an aspiring doula, you could be a past doula. But it's, you don't even, you could be a midwife, whomever. But it's really focused on, staying abreast of what's going on in the reproductive health space, right? And so, they create a policy agenda for the year. There are moments where they will go, up to Albany, or may go see, city council members, in order to advocate for certain policies. Some of the things that we are currently watching out for and have been is, of course, doula Medicaid reimbursement. It is now in its second phase of, now there's group enrollment. And so, organizations can enroll and bill for their doulas. There's still a lot that needs to be done in regards to, in ensuring that there's going to be funding for that. Now that we know that federal funds, and Medicaid is under the chopping block, what does that mean for doula Medicaid reimbursement? And making sure that that safety net is still in place, because again, there's been champions around that, so since it's like, Senator Baroque, Senator Webb, and others who have really like, put in the groundwork for legislation to be passed. And for doulas, to be able to provide this work in their respective communities. And now it's at risk. We need to continue to look at informed consent laws. And so, folks who are going pregnant, and going to birth and being illegally drug tested, or not being able to give true informed consent is still a problem. Right. And so, what does it mean for that law to pass and for providers to really get education and protocols around that, but not just protocols, like really looking at the implementation and accountability around that. On the city level, looking at Article 6. And so most recently, myself and others, there's a op-ed in regards to public health. And again, ties back to federal funding, but this was monies that, were initially funded at 36% by the city. It went down to 20%. And so, like, what does it mean to bring that number back up? Because if federal funding is pulled, we need another funding stream to be able to continue to fund public health, to be able to retain work for the workforce, for programming and for access to reproductive health care. So yeah, that's just some, but there's plenty of things that, we need to start to look at, like how we are codifying laws, around reproductive health, how we are codifying or putting in budgetary lines specifically for reproductive health access, understanding that those federal funds may not be there. So what does it mean on a state level to really shift that? And then understanding, the city, has a responsibility to its constituents, right? And so we have like underutilized offices, such as like the New York City Commission for Gender Equity, right? Which I'm also a commissioner on. This is a space, that was intended to review gender, policies, and the office has not been working the way it was intended to work for a while now, right? And so, like, what does it mean for there to be proper governance over the space, to be able to use that maybe even as a tool for accountability? So, similar to, we have the Human Rights Commission. This is a commission that is there that could potentially look into the review of maternal deaths and cases. And so instead of us just having, a task force to do this, why not have a standard office, where, patients and others can call in and know that they have a reliable resource that's going to investigate and look into this and be able to, find ways and means to be able to support community. So, there's a couple of different things that we have to start to look at, because of the ways in which this, just the federal administration affects state policies, while also New York state is the precipice for everything in every other state. Like, we lay down the blueprint for what is the possibility for something to happen. And I think that it's an opportunity for us to build up our healthcare infrastructure, to pass bills like the CPM bill, so that we can have CPMs who are working within our communities, who are providing, holistic maternity care, right? It's an opportunity for us to expand birth centers. There's a birth center bill to pass that. It is an opportunity to look at underutilized spaces and see how that we can use them, as well as community-based organizations that have had a footing in the community for a long time, as spaces that are, that could possibly offer wraparound services, right? And so instead of clinics closing, really trying to restructure the ways in which funding is allocated, and repurpose the offices that we already have in place, you know what I mean? So that we can be prepared for everything that is ahead of us, and not feel like we have to catch up and be reactionary. We have an opportunity now to be responsive.